So I'd like to begin by stressing that this is a fast-moving situation, and today I've asked our medical director to join us in addition to our Director General. Now, at the press briefing yesterday, Caroline referred to the modelling work that was being updated. Late afternoon yesterday, the government received this updated information from the health professionals. So based on this updated modelling and expert advice from Dr. Ivan Muscat, the Deputy Medical Officer for Health, we've issued a series of recommendations aimed at protecting islanders and significantly containing the number of potential coronavirus cases in Jersey. This modelling will continue to be an invaluable tool in helping us to develop our response to the virus in Jersey and will continue to be updated. The decisions which were made yesterday evening and released overnight have been discussed at a special meeting with the Council Ministers this morning. Further measures are under consideration and more information will be released in the coming days. The actions we have recommended are both sensible and practical, with which members of the public can take immediately. And by doing so, they will protect the most vulnerable within our community. So we are asking over 65s who wish to continue in their roles to limit unnecessary contact with people outside of their homes unless absolutely essential. Islanders with a combination of flu-like symptoms including fever, cough, muscle aches and headaches should self-isolate until they are symptom-free for a minimum of 7 days. And from today, we're asking that islanders only undertake essential travel into and out of the island. You can still travel for medical and compassionate purposes, and key workers required to keep our essential services running can also continue travelling. Now, I would ask that all islanders read in detail the guidance that can be found on gov.je and which has been shared extensively by the media. Any islander with immediate concerns can call our helpline on 445566. I want to emphasise that these are evidence-led measures based on the island's demographics and health model. Our approach to the coronavirus pandemic is health-led, and all of our decisions are made based on the most up-to-date medical advice and modelling. As I've said, that updated modelling was received late yesterday afternoon and was discussed in detail yesterday evening by ministers before being published. Following the meeting of the Council Ministers this morning, the Emergency Council will meet again on Tuesday. The Minister for Health and Social Services will speak in more detail on the importance of the healthcare measures we are recommending. But I want to emphasise that social distancing is one of the most important things that over 65s can do to protect themselves from coronavirus. It could save lives by up to 35% in this age group and reduce the demand on our health service at the crucial times. We are going to issue some detailed guidelines over the next few days as to what this will mean in practice for affected islanders. I do also want to thank officials from across the Government of Jersey for their continued work to protect our community, and I want to thank you, the members of the media who are here over the weekend, to ensure that this important advice is circulated to islanders. And let me conclude by saying we are a resilient community, and we all need to work together to protect the vulnerable and to navigate our way successfully through this challenge. And that, I believe, we are well placed to do. So thank you for listening to my words. I shall hand over to Richard now, and then we'll hand over to Lyndon, and then obviously we'll have some questions for us. Richard.
Yes, thank you. As you have heard from the Chief Minister, we have updated advice to islanders based on very recent health modelling and expert advice received from Dr. Muscat, our Deputy Medical Officer for Health. And those recommendations are aimed at protecting islanders and significantly containing the impact of potential coronavirus cases in Jersey. And as the Chief Minister has said, our approach to the coronavirus pandemic is and must be health-led. All our decisions are based on the most up-to-date modelling. So our officials are constantly receiving and analysing and interpreting the most recent medical data. We will issue, as Council of Ministers, issue advice appropriate for Jersey based on that data as soon as it is available. And I know that some islanders are looking at what is happening in other countries and wondering why Jersey's not always following suit with similar measures. But it is about implementing the right measures at the right time for our community here. And this is because Jersey is some time behind other countries in cases first presenting. We are in a unique scenario, and we must react to that scenario accordingly. We must also strike the right balance between protecting our most vulnerable residents and doing this in a measured way that doesn't put them at increased risk or adversely impact on health services. So for this reason, I repeat what the Chief Minister has said. Social distancing is one of the most important things that over 65s can do to protect themselves from the virus. Social distancing means limiting unnecessary contact with people outside of your household unless absolutely essential. We're currently recommending this for over 65s who are not essential for the running of the island services. So for those 65-year-olds and above who do choose to adhere to social distancing when not in their homes, they should keep a distance of 1 metre or 3 feet from other people. Therefore, there may need to be a need for them to avoid large public gatherings, and if at work or not at home, they should avoid using public transport during peak hours unless essential. I want to emphasise that social distancing and self-isolation are not the same. So, whilst practising social distancing, we can still go out, get fresh air, do gardening, walk our dogs along a quiet lane. And for those practising social distancing, the key advice is just not to come into close contact with others. Self-isolation, however, is quite different. It requires you to avoid any contact with others and to remain in a physically isolated space so that you cannot transmit the virus. I would urge islanders not to become alarmed, but to follow and share the published government advice, which is based on good health advice. Please do not panic buy food or medicines. Think of others and only buy what you need. Whilst I understand there's much fear about coronavirus, most people who may contract the virus will experience mild symptoms and will not need to engage with our health system. We know as well this is a challenging time for people emotionally and mentally, and I would urge people to be considerate to one another, be prepared to live a little differently and quietly for a while. If people wish to, they can access the listening lounge by phone for support, and I'd urge us all to keep talking with friends, family and neighbours. I'd urge islanders to access our online resources at gov.je first and only turn to our helpline on 4455 66 if they have urgent concerns about their health. And doing that will allow us to ensure the most critical inquiries are escalated first. I want to echo the praise of the Chief Minister, thanking officials from across the Government of Jersey, particularly our wonderful health and social care staff who are providing care across the whole island. All of them have done professional, dedicated work protecting our community. I am proud of our island. We are a resilient community, and I know we will work together. Please listen to the latest advice, share it as much as you can, and let's go forward and support each other. Thank you.
Thank you, and thank you, Richard, Chief Minister. Good afternoon. The recommendations made today and in the days ahead will have a significant impact on some islanders' day-to-day lives and a consequential effect on our businesses. But that advice is right for our community. The island's public health is and must remain our first priority. However, alongside that focus, we will work quickly and effectively to ensure that any negative impacts on our economy are kept to a minimum and that employees and employers are supported and protected. Officials are already exploring the likely effects of the most exposed sectors of our economy, including hospitality, travel, retail, and agriculture and fisheries. The measures that are necessary to protect our community will see those sectors impacted by lower visitor numbers and reduced footfall, which will consequently lead to a reduced demand for local products. I am leading a team of officials over the weekend to determine appropriate measures that the government can implement in a very short time frame to support those industries. These will be in addition to the measures already announced, including deferring the payment of social security contributions and the deferral of GST payments and payment deferrals where the government is a landlord to a local business. We are working with our arm's length organisation, Jersey Business, who have been given extra resources to advise and support businesses to enact their business continuity plans and to continue trading. We are also considering risks to the island's critical supply chain, particularly in relation to sea routes, and this week the Emergency Council endorsed measures to provide greater resilience on the key route to the UK. I am grateful to Condor, who have already implemented measures to provide additional resilience to the island's freight capacity. We are working closely with the ports of Jersey to increase awareness for travellers at the airport and ferry terminals on preventative steps, good hand hygiene, and how to seek advice if they are concerned about their health. The Coronavirus Business Group will continue to meet regularly to closely monitor the continuing impact on businesses and to ensure appropriate government action and support is available. I know this will be difficult for local businesses, but we have a robust economy and secure public finances. However, coronavirus is having a significant impact on our economy, but it will be temporary. Support for business is support for people, protecting jobs and livelihoods, and we will stand firmly behind our economy, our businesses, and their employees. Finally, my advice to islanders is to exercise good common sense, follow the best health and travel advice, and within that advice, to continue to support your local economy as much as you possibly can.
Thank you very much, Lyndon. So that concludes the kind of official words from us in the update since yesterday. Over to you for which questions you want to put to us. Who wants to be first?
Yeah, go on and I will do.
Go on.
So, Liam, thank you from Channel TV. I understand that obviously this is a quick changing subject, of course, and the advice is always changing.
Mm-hmm.
But if we look to Guernsey, for instance, they implemented similar measures 2 days ago. Why hasn't it taken us 48 hours to come to a similar position as they are at?
I think actually we're in slightly different positions, but and you know we support each other in terms of we support Guernsey and also hopefully they support Jersey. Guernsey supports Jersey in terms of we're all slightly different positions in terms of approaches. But for Jersey, we are basing on the health advice we receive and when we receive it, and it is about making decisions based on the evidence because the health of islanders is incredibly important. You'd expect us to be doing it on the basis of the evidence we receive, and so the evidence we received is based on the new modelling data. Perhaps Patrick and Caroline might want to address that. That we received yesterday late afternoon, as I said, which was actually referred to in the press briefing yesterday, and as a result of that, the importance of the social distancing, even at this stage, was certainly emphasised in that briefing, and that is why we've taken the decisions now to start basically bringing the public up to that next stage. This is a fast-moving situation, and I will say that even from today, matters will continue to escalate and you'll still continue to see changes. We want to get this information out at the early part of the weekend so that hopefully then islanders can start adapting to it over the course of the next few days rather than, for example, waiting until Monday. Want to add to that, Caroline or Patrick?
This is a completely unfamiliar virus, as we talked about yesterday, and we are making decisions based on robust information, decisions that will positively impact outcomes for Jersey.
I would just add a bit around the model. The model provides us with a lot of data. We interpret that data and we need to understand it. We're very grateful for the measures that have been put in place, because we know those measures will have an impact upon how we approach and manage the situation. But we're also very aware that the measures that we've asked for have a significant impact on others within government and on all islanders. So we need to be absolutely sure what we're asking for is in the best interests of everybody.
Please could you provide us an update on this modelling? We didn't have obviously these travel restrictions in place just 24 hours ago. So what has so dramatically changed within this period? Can you give us a sense of that?
So I don't think there's been dramatic changes. I just think there's been greater understanding by us from our interrogation of the data. Echoing what Patrick has said, before we make any decision that is significantly going to impact on islanders' lives, because this virus is already going to impact on the way we live, we want to make sure that the information that we are looking at is absolutely robust, so the decision making we make for islanders is the right decision. The information will continue to change as our knowledge about the virus continues to change, and we will continue to make decisions based on that robust information.
In the stage we're at, this is all about advice. So it is travel advice and tightening up on that advice. Lyndon, you want to add to that?
Well, every day we're being presented with new facts, and every day we will continue to act on those new facts and make the best decisions based on what we're getting on that particular day. Things are moving very quickly, and that's why we are working through the weekend with the economy group to bring in support and action as soon as we possibly can, because the impact on business now is beginning to escalate fairly quickly.
Just to pick up on the thread about business there and the impact on the economy, we're getting a lot of comments here on our Facebook stream. People are particularly interested in knowing what about sole traders, people who are self-employed, those who might rely on going into other people's homes to conduct work. If they're required to social distance, how can they be supported?
The support we've brought in, for example, the package of support we announced on Thursday will have a positive impact on all businesses, whether they're companies or sole traders, however they work. The deferral of GST and social security payments is a valuable support to their cash flows. In relation to how they work, we're advising them to work and carry out their business, whatever that may be, in lines with the best medical guidelines that we've issued, and those will be updated regularly.
And so once those guidelines are issued, and I said, keep an eye on the website all the time, because that will be fast changing. There will be circumstances where you just have to do things differently. It doesn't mean you have to stop everything, but it will depend always on the medical advice we get. So, for example, I know there are at least 2 businesses locally who are offering home deliveries and things like that. So obviously, from one side, you're making sure that the people who are in either at that point social isolation but potential social distancing can still be supplied with things. And on the other side, obviously, that retail activity is still taking place, but just in a different way. I don't know, Richard, if you want to talk about the medical side of that, or if we just want to move on to the next question.
Well, obviously we know that there are health and care staff who need to be close to people, but the health authorities are carefully considering what is needed, the advice that will be given to those staff, and that will be forthcoming very soon.
Well, we saw yesterday the impacts that's having on, say, for example, the fishing industry here. What's being done to try and ensure that businesses that maybe depend on shipping their produce maybe off island, how will they still get that support?
So on panel, so high level stuff initially, obviously we took some measures, we've previously taken some measures around assisting people, individuals obviously, and that was around the STIA side of things, that was around the self-employed. We've taken additional measures which is around the social security contributions and GST. So those have been agreed and announced I think yesterday now, wasn't it? Feels a long time ago. But obviously what we're now going, and we can see that as things are going to escalate, we are going to have to go to a different level of support, and all sorts of businesses,
Yes.
and we will be doing so.
And it's all urgent, but fishing is a particularly urgent challenge for us at the moment, given the recent announcements that have affected their export markets in France due to coronavirus. And we know that direct financial support is going to have to be made available to fishermen. We will be meeting with them in the early part of next week to come to a solution that works for all parties, and that's high priority.
I think the other thing always to bear in mind, we've said this a number of times in the past few days and even the past couple of weeks, we are in a good financial position. We have a strong balance sheet, with strong reserves. We did put some money aside even in last year in the government plan, which is around building in contingency and adding to what we call the stabilisation fund, which is a reserve that is there for these type of events. And I think as we will progress over the next few days and the work that's happening over the weekend, we do have access to that money. Some funds are already being released, and we will see more as that comes out. We've got to do it carefully. We've got to make sure we achieve the best impact, but we're absolutely determined that we support islanders, we support businesses, always based though, it is about protecting the health of the island and our community.
And just on the sort of health advice, obviously islanders will have seen, as it's been referenced already, the advice changing quite quickly. Perhaps with having to keep up to date with all the latest advice, there's different things possibly going around on Facebook. There's a lot of sort of talk about maybe herd immunity and phrases like that. What is the best way of making sure an island that is as small as ours can stay?
I think we're definitely talking technical here.
Yeah,
That's
so
where we hand
I'm
over to the
definitely going to
professionals.
ask our medical director
Yeah.
to answer that question.
So could you just clarify your question?
So basically, there's a lot being said about the idea of herd immunity and perhaps different ways we could be trying to keep everyone in the island sort of flapping the curve, things like that.
Okay.
What is the best way to tackle this for an island like Jersey?
So the best way to tackle this for an island like Jersey is to have the virus spread across the island in a controlled and over as long a period as possible. What we're trying to avoid is a big peak in the number of people suffering from the virus at any one time, because that inevitably puts significant pressure on our health system. So the measures that we've asked for will hopefully help with that. And so if we can have fewer people suffering at any one time, then we can manage those people much better within the resources that we have.
Is there a sort of message we could have for I think it's well known now that the most vulnerable are sort of over 65, over 70s, and people with underlying health conditions. You reiterated it at the start as well that for most people, it's going to present as sort of mild symptoms. Is there a message perhaps we put out then to people that they shouldn't worry if they do get these symptoms, if they do become ill, as long as they adhere to the advice?
The majority of people, as you say, will have a relatively mild illness. The important part from that perspective that those people can pass the virus on to our more vulnerable islanders. So it's asking them to sort of react and behave in a responsible way. And as we've talked about, protecting our most vulnerable patients, who many of whom are over 65, but there are others with long-term conditions.
And just an economic question now. The Unite Union put out a statement today saying that up to 45 people could lose their jobs at Jersey Airport in light of the collapse of Flybe because of coronavirus, of course. What contingencies are in place? What are you doing to kind of make sure that that doesn't happen? And what advice are you putting out there to people?
Well, I haven't seen the statement, so I can't comment on that particular case. But Ports of Jersey, the Chief Executive Officer, and some of his team from Ports of Jersey are part of our economic working group that's working over the weekend to address those sort of issues. So we'll have answers on how the ports are going to deal with that in the early part of next week.
Just to do, in terms of telling over 65s or recommending to them that they shouldn't get the bus, I was wondering how would this impact FitzyBus, and are they part of that contingency fund? Will they receive support for any losses they might make?
Just to clarify, we said not at peak times.
So they
Okay,
can select.
so that's what we're saying. This is about social distancing. So it's about being careful about how close you get to people, in layman's terms, not about hiding away and being a social isolation, which is a really quite important understanding. But we also accept, and that is why, and that it will require some specific guidance to give some examples and things like that, and we'll be putting that out over the next few days. The importance was to start getting that message out, because again, it is about the time critical bit. We are better placed because we are behind the UK before the impact comes through. So the earlier we get this information out, the better we prepare for it, and hopefully then it's going back to the flatten the curve, flatten the wave, flatten the sombrero, I believe is the other expression I've heard, about just lessening that impact on our services overall. Anybody want to add to that at all?
I think
Okay.
you've said that.
Okay.
In the sort of scenario whereby mum, dad, 2 children, mum comes down sick and she's presenting with the symptoms you've described, so she needs to self-isolate, what do the other members of the family do in that situation?
We're developing advice on that. I think in that particular scenario that you've described, it would be sensible for them to self-isolate as well.
You had a meeting last week, I think it was, where you said in the worst case scenario you could expect 50 deaths in Jersey. Is that still, are you still expecting that could be the worst case scenario, or has it changed?
We're getting back to the modelling here, and while the modelling gives us very clear information about the measures that we've asked for and the impact they will have, we need to do a lot more interrogation of that data to understand specific figures at this point. But we're constantly looking at it, we're constantly seeing what is happening around the world, and we will get a better understanding of that over time.
The focus is on flattening it, so that we avoid getting to the scenario that we don't want to get to. So it's a response across the whole of the island around flattening that virus.
And sorry, just another one on travel then. So I suppose for a lot of people, maybe they've got holidays booked to go off sometime, maybe for Easter holidays or things like that, or even for businesses, but maybe if you're splitting your time between Jersey and Guernsey, because everything just is still advice at the minute, there could be a lot of islanders or businesses out of pocket, maybe trying to change travel plans. What do you think the best advice is for them to sort of try and carry on life as normal? Because obviously we've heard quite a lot over the last week or so. It's all developed quite quickly.
I think it's fair to say, whilst we want to encourage islanders to continue to live life and participate in our economy, following the best guidelines, these are exceptional circumstances, and the feedback we're getting at the moment is most islanders are beginning to and will heed that advice. The more people that heed that advice, the less of the risk to the island of the disease, the virus developing in the way that's been explained. So our advice is firm: travel only for essential reasons or compassionate reasons, and be mindful of the positive impact that following the advice will have on the island.
And how do we get that balance then? Because obviously there is the economic importance of keeping the island running and supporting local businesses, but at the same time we're saying, maybe don't, try and not to come into contact with people, maybe make these sensible precautions. Where do we strike that balance between, keeping the island's economy moving and health?
Well, I think the advice that's been issued in yesterday and today is helping to strike that balance. I think that this is a very good first step. It's likely, as we progress into the days and weeks ahead, that advice will progress, and we're going to be monitoring the situation very closely. From my perspective, whilst I've said the health of islanders come first, we're going to be working very closely with all sectors of the economy to try and ensure that businesses, and when I say businesses, we're talking about people as well, because most people are employed by businesses, and it's important that they are able to be paid, and which will enable them to live and follow the advice that we're giving.
touching on the subject of travel, at Express we've been getting dozens of queries from concerned parents. We know that there are over 1,000 university students spread across from Jersey, spread across the UK and Europe, and they're very concerned whether their students should come back to the island or whether they should stay put. What would be your advice on that?
So I'm not going to give you specific advice now, but we have been discussing it at Council Ministers and Emergency Education Minister will be some guidelines, and I expect the early part of next week. But it is a continuing situation because it is well, it is a continuing situation. Of course, each country now is changing its own circumstances, and that's evolving literally almost every hour. So at this stage, guidelines will be issued early part of next week. Can I hand over to Caroline as well, I think.
Again, it gets back to sort of emerging situation, and it gets back to what I said earlier, is that we appreciate within health decisions such as that will have other significant impacts, and it's my colleague, the Medical Officer for Health, is developing that advice and got strength and balance.
What support is out there for our Polish, Portuguese communities, other communities that aren't from the island? Are they getting the advice that we're getting here? Is it being translated?
Yes, if you actually look on the website, you'll find that at the very least the posters that are there are in a certain number of languages. That's been done, and I think actually as the other advice goes out, we'll make sure that is translated as well. But the initial advice that's been on the website has been translated into languages other than English and aimed at the main, as you say, external populations, as it were, to the island communities.
Sorry. The travel advice is advice at the moment.
Yes.
Firstly, one, could we get to the point where it's not advice and it's legislation or an official ban? And two, do you recognise that under an advice policy, some people aren't necessarily going to adhere to the advice?
Yes, that's why we do have to make the difference. This is advice. It is also advice from the government, but it is advice, and therefore that is all we can do at this stage. We cannot compel. Now, as matters develop over the next few weeks, we are seeing all sorts of travel bans occurring outside other jurisdictions, which will also then potentially have an impact overall as to what people actually can do. But at this stage, from Jersey's point of view, all we can do is advise, but the advice, we hope, is pretty clear.
On the topic of testing, what is the threshold for someone to be able to access a coronavirus test? We've heard from some people who've said they've developed symptoms but called the hotline and been told not to have one. So would you be able to elaborate on that?
So it's the same as what I articulated yesterday, which is if you come back from a tier 1 and tier 2 country, then you can access testing. If you have significant concerns and you contact the helpline, then you will be given the appropriate advice around how you can or cannot access a test.
So no, sorry. Just going back to that, there may be some people who came back maybe on one of the same flights as one of the patients who's currently got the coronavirus and have a confirmed case. I know they had the phone call. Environmental Health got in touch with them. But then after a while, despite being told to go into self-isolation, they then didn't need to have a test. How is that determined then, really? Sort of who, was there a proximity thing, or what's the threshold, if you like?
There's really clear guidelines around contact tracing and around the area that surrounds the index contact. So they will have been contacted and advised. If anybody out there is concerned about their health, they need to phone the helpline, or they will have received the appropriate clinical guidance.
Okay, and sorry, just one more question. I suppose as things develop and the number of cases, I'm sure, will go up, but hopefully at a slower rate than it might if we don't take any precautions. I'm sure the demands on the health service will be going up. Will there be any sort of restrictions put in place for staff, whether that's frontline nurses or at the Director General level, perhaps, of things like when it comes to taking leave or things like that? Would there be any sort of operational restrictions put in place?
We have robust business continuity plans that we have been standing up since the start of the year. Patrick and I will be attending a silver meeting in the hospital at 3:30 this afternoon to review current plans in light of the changing information. So So I am confident that we will be able to deliver the response that is able to deliver care for islanders.
Can you clarify what those continuity plans are at this stage in time?
They're multiple, far too long for me to go into here, but be assured we are looking at staff. We are looking at staff both from the point of providing cover for care, but also staff resilience. We need to look after our staff and make sure that they are fit and able to protect islanders. We're also looking at our supply chain, as I'm sure other organisations are across the island, and we are looking at the amount of care that we think we might need to deliver outside of the hospital. So we have multiple business continuity plans in place. So, no, don't know if you wish to add, Patrick?
There are business continuity plans being developed for every service, and we're developing what that looks like in the dependencies between each service, so that's sort of moving feast. It changes constantly, and we keep updating.
And not just within the hospital, working closely with GP colleagues, working with other care providers across the island, so to ensure that we are one health community.
Okay, I think we shall draw that to a close, but can I thank you all for coming in on the weekend. Hopefully you do understand, as we've said before, it's a fast-moving scenario. We felt we had to take the measures we did last night just to get the information out to islanders this weekend, and then you can start understanding them, adapting their own behaviours. More things will be coming through this week. We alluded to it yesterday, and so there'll be, and also further guidelines and things will be issued. Look at the website, use the helplines, and actually still keep washing your hands, I think is the answer, isn't it?
Yes, please.
But thank you very much for today.
Thank you.
Okay.
Thank you.